Welcome back to Did You Know, a podcast by Partner Veterinary. In this series, we explore all things veterinary medicine and all things partner. In each episode, we answer some of the most common questions we are asked, from HR to emergencies and everything in between. If it happens at Partner, we'll cover it. Dr. Pierre Charlebois, a board-certified critical care specialist in our Richmond location, joins the podcast today to talk about the role of a criticalist, how it differs from an emergency care veterinarian, and what having a criticalist at Partner means for the treatment of our patients.
My name is Dr. Pierre Charlebois. I'm a veterinary criticalist that works at Partner Emergency and Specialty. Starting with Partner was fairly recent. Kind of the owners of the hospital we've known for many, many years, and through a very long, convoluted chain of people knowing people, we know we wanted to come in the area. And so we knew, Katie for a long time. My wife had worked in one of the hospitals that she was kind of managing, and we knew that she's always taken care of everybody that works under her. We know that emergency medicine is in some ways a struggling field in terms of stress and quality of life. And there's a lot of obstacles that are associated with a 24-hour service, right? And I know that's something that I was hoping that she did such a great job at her when I knew her before at her previous positions, that I really wanted that to translate to this particular hospital. And so that was honestly a huge factor for us to want to come in for partners. We also knew a lot of people that worked at the hospital, which was another kind of thing that we said, what, they seem very happy there. So why don't we just join the team?
Can you tell me a little bit about how you got started in the veterinary profession?
Yeah, so I think probably a similar story to a lot of people. Kind of growing up, you love animals, you try to have animals. My parents were thankfully very accommodating to that. And so cats, dogs, fish, lizards, all these things. Initially, kind of going through school, my thought was that I wanted to go into kind of conservation, marine biology, things like that, which is a little bit more kind of challenging for opportunities. And so after a while, I ended up decided that, maybe veterinary medicine sounds like a pretty good alternative. My father was also a veterinarian, which, not that he kind of pushed me in this, but, it kind of helps stimulate interest. And so that's how I ended up kind of floating towards veterinary medicine. And then after my initial degree, I decided that I wanted to specialize a little bit more just out of interest, right? You kind of do this for a couple of years. You think, I really like this aspect, and maybe you don't want to do some other aspects as much. And so you have an opportunity to go and do that every day of your life.
Your role as a veterinary criticalist, how is this different from emergency care?
Yeah, it's a kind of a common question that people have. And I think that there is a lot of overlap, but the unique thing is when you're a criticalist, which is the equivalent to, if you think in the human world, they call them intensivists. And so the person that's generally responsible for looking after the intensive care unit patients, and they're a little bit of jack of all trades kind of situation, which is part of the reason I like it, because you have to be able to manage these patients. But so my role is, even though depending on the hospital that you work at, you have this dynamic that works for the hospital and you kind of get the culture. So sometimes some hospitals will have a criticalist looks only after the intensive care patients, but sometimes they'll do that and also receive some patients in the ER, and sometimes you'll do shifts in one or other position. Our training allows us to hopefully be very proficient in both of those areas. But if you think about an emergency clinician, an emergency doctor, they will receive, assess, make a treatment plan, and then kind of disseminate, can I just treat as outpatient, or which other specialty do you need? And if they happen to say, you know what, you're really sick, you need to go into the intensive care unit, this is where I take over that case, that patient, and then I'm micromanaging. And so the unique thing that I like about my profession is that the ER doctors are just so phenomenal at just seeing volumes of patients and kind of juggling all this. And whereas in my world, it's a little bit more like, well, I'm going to take less patients, but they just require so much one-on-one time. I mean, you need to change treatments, every couple of hours. And so that eats up a lot of time. So if I can look after those patients and kind of free the ER doctors away from that, they can be a lot more efficient in their world. So that's sort of the distinction between the two of them. And the other thing that my training allows me to do is that ultimately in the future, there's a possibility, we could do things like dialysis or plasma exchange for, dogs usually that get into toxic medications to kind of filter their blood out, the toxin out of their blood. And the other thing that allows us to do is that we have the training that ultimately we might be able to get a mechanical ventilator. So really severe respiratory diseases like pneumonia. So I've been trained and I've used the ventilator multiple times, and so that might be something that we can offer, which is pretty unique because a lot of hospitals are not able to offer that. And so that's our hope in the future to be able to offer that to the community.
Do you have any cases in your time that stick out and really are memorable for you?
Yeah. So, I mean, there's always some that haunt you and some that you're really proud of. And I think some of the most rewarding ones, I have two in my mind over the last 3 years that I think of. And one being that there was a dog, and this was my biggest patient I've ever treated. He was a Great Dane, and he was 120 kilos, which is 240 pounds or so. I'm massive. I mean, very massive. And he was in a house fire. The farm burnt down and he was very sick, his lungs very damaged. So he actually had to be on mechanical ventilator. And so thankfully, our ventilators are the same machines that people use. So you can use them in those big patients. But he was just such a sweet dog. And after a few days, we're able to get him off the ventilator. And then he ended up going home. And it was just such a rewarding thing to see him go home. So that's one of my biggest highlights the last few years. And then kind of the opposite to that, actually, funny enough, there was a puppy, I think it was 6 or 8 months of age, and he got an infection in his kidneys called leptospirosis, which is, it gives you very bad kidney damage and it prevents you from urinating if it's really bad. And a lot of patients can die. But if you can do things like dialysis, so we did dialysis on this little itty bitty, I want to say less than 10 pounds little puppy, and he did great. He went home, he was happy, and yeah, he's so those are the kind of cases that to me they stand out, because even though this is a hard job, you don't save all the patients, obviously, but you take some of these patients and you think, wow, they come in, almost on fire, like a dumpster fire, and then you turn them around and they go home and you think, wow, that's amazing that we can even do that, right? And so those cases are the ones you kind of hang on to and kind of, push you forward and keeps you going, right? So
makes everything worth it when you can help patients like that and send them home with their families.
Yep, exactly.
Yeah.
So, yep.
What impact do you want to leave on the veterinary profession?
I think for me, I've been doing this for, it's going to be probably almost 9, maybe 10 years now. And I've always worked either kind of internships or emergency medicine. I've never done private practice. And so I can really speak just to my world. But I think one thing that I've noticed, and a lot of people will kind of attest to that too, is kind of since COVID, just a lack of resources of veterinarians and people burning out and having this huge struggle with quality of life. And I think what I'd like to do is to, and I think Partner is a good candidate as a model to kind of shape into something like that, is to be able to find a way that, can you do your job? Yes, it's a stressful job for multiple reasons, right? It's life or death. You have to talk to emotional owners. There's a lot of finances involved. People have to make hard decisions, but it is a really rewarding job. How can you balance these roller coaster ups and downs with a good quality of life, right? And so what I'd really like to do is to be able to contribute to a practice that says, like, let's figure out a way to keep everybody happy. I think, do you need to work a little bit less? Do you have adjustable or, schedule that fit your lifestyle? Are they flexible to say, yeah, I'm going to work a lot for a couple of weeks and then I want a bit of time off to travel, like something like that. I would really love to be in a hospital that finds the way to make as many emergency staff, and I don't mean just doctors, right? This is a tough job too for technicians, for assistant, everybody involved. So I want to make sure it's clear that I think that should apply to everybody involved in this service at all, because everybody works so hard and they get so attached to the patients and they take such good care. And I think that's the biggest thing for me, is to say, yes, you want to do good medicine, take care of patients and owners, but you got to take care of their staff. And I don't think they're mutually exclusive. I think it's just more of a challenge than some other aspects of medicine. Yeah.
Thank you so much. I really appreciate you taking the time to chat with us today.
Oh, you're very welcome.
Thank you for listening to Did You Know? Is there something about Partner that you want to know? Email us at letstalk@partnervesc.com. Who knows, we might turn your question into an entire episode. You can now find us wherever you listen to all of your other favorite podcasts. Subscribe now.